Welcome back. Get a safe drive. Here we are at work. Let's see what the day holds. We have, other than a couple of other surgeries and some appointments, 2 awesome possums coming from Sandy Pines Wildlife Rescue way up east and north in Napanee. So it's gonna be an exciting day. They gotta go to the dentist, and I'm the dentist.
Boy.
What's up?
All right, you're gonna lose your nutters, Batty.
So I just got a message from Martina that they're running late. Possums won't be here till about 11:30. So it's paperwork time, some cases, and kind of rearrange our surgeries and make sure we all get out of here at a good time.
Yeah. It's okay, man. We're gonna give you a haircut today. We're gonna make you sleepy, though.
Hey everybody, we're finally on our way to see Dr. Clifford Markham, and the 2 possums are in the back. They're just covered in a sheet right now to reduce stress, but we're almost there, so we'll see you soon.
Hey, morning's still here. We unfortunately had a euthanasia of a patient who had been suffering from both kidney disease and cancer. But it went very peacefully. Really, really nice family. So we'll kind of take a couple minutes to collect ourselves and then start the crazy surgery day off with a couple of cat spay and neuters from the local animal rescue.
Priceless.
Tongue.exe has stopped working.
So I thought that was the bladder for a second.
That's not the bladder?
Well, very well maybe. But this felt like the bladder. Pretty sure you can only have one. So this little girl is pregnant. Oh, 1, 2, 3, 4, 5, 6 fetuses. This is her uterus. She's pregnant.
She's pregnant, yeah.
Yeah. Or she's going to be not pregnant soon.
She can't have the baby?
No, they've elected. She's early enough to proceed with abortion, and we got a lot of kittens that can't find homes, so it's kind of a pragmatic decision instead of an emotional one, which is understandable. All done? Ready to go home? What was this guy's story? How did they come into Sandy Pines?
Mom was hit by a car, and then it was 6 babies that went out.
How old were they?
I think they were almost 8 weeks because their eyes were just starting to open when they came in.
So we used the spermatic cord to tie the knots around the blood vessels. No sutures. All natural. The barn cat, kind of fractious black cat that needed to be neutered. He didn't appreciate getting neutered, so he gave me a little bit of a love scratch there, but I figure I deserve it considering what we did. And then we sedated the possums, so awesome possum time, and we will see how those guys go. And then last but not least, a staff member's dog needs a dental cleaning and a couple of lumps removed, and then eventually my day will be done.
be interesting actually to see what the other one looks like, with the other canine on the other side.
Do a little comparison.
Yeah, can we do that actually? Because I need to know if this is dying off. So if you notice, and it's the same thing in cats and dogs, that the dark space is the pulp chamber. It's like the root, essentially. See how wide it is? Like there's hardly any enamel. So it makes the tooth more fragile. It also makes the tooth harder to remove. Wakey, dude.
Boy, it was tough getting some of those those canine teeth out, and they take a long time to wake up. But it's been a fun day so far. We got one more surgery to go, and then a bit of paperwork, and then the atypical day of this veterinarian is finally over, and I get to go home and relax. So keep watching.
They did great under anesthesia. It was pretty hardy.
Yeah, they did all right. It was your first time intubating possums,
Yep.
just like a cat.
Exactly like a cat.
Just like a cat. And the plan is you guys are driving back to Napanee now. And what's going to happen with these guys the next few weeks?
Well, they're going to probably be in like a smaller carrier for now, like smaller than their regular enclosure, because they're normally in a very big enclosure altogether. But we're probably going to separate them now that we know that they're injuring themselves. Could potentially be because they're fighting. We're not sure yet. They are showing signs of aggression. So yeah, they're going to be separated and pain meds for 10 days, like you said, and then hopefully we'll be able to get them outside, get used to the weather, and then release as soon as possible.
This was supposed to also just be a dental cleaning, and there ended up being several teeth that, surprise, surprise, had some really unusual pockets and periodontal disease, so we had to do a few extractions. I was worried that it was going to be sort of stuck underneath the muscle instead of sitting up top in the fat layer. So we decided to move her into the what I call the clean surgery room, and lo and behold, this fatty lump was in between the two heads of the tricep muscle, and I had to sort of make this tiny little incision and open up the fascia, the tissue, and then you just kind of scoop it out with your hand. You know, I've never done possum dentistries before, a lot of cats and dogs, a little bit with some other animals, gophers, things like that. I did little braces on a gopher once, sort of. And it was tricky. The teeth are strong, but also brittle because that they're young and the pulp chamber is so big. So you have to be careful because the enamel can crack quite easily. But they ended up, it was kind of just like a tricky dog canine tooth extraction. So they did very well. The day turned into a very long day. I'm barely beating the sun setting here. It was a very successful day, and these animals are going to recover very, very well. I've already received texts from Martina and from Amber that the possums have woken up very well, and they're pretty much back at Sandy Pines now.
And soon they're going to be put into their own cages so they can kind of be kept quiet. They'll be fed some soft food for a while. And within a couple of weeks, they're going to be released in what's called a soft release, where they'll be released into a location where there can be food that's sort of fed or provided for them occasionally, so that they can sort of half hunt on their own, half be fed this food. But it was a very atypical day at a veterinarian clinic, and even for me, it was a very atypical day. But I really appreciate you guys watching it. I hope that you learned a lot. I hope you're entertained. Of course, I hope that you comment and like and share. And last but not least, please be kind to animals. Thanks.